you are actually like a really interesting story. You're a patient I treated about 2 years ago, and I pulled up your notes before we had this meeting just to kind of review myself, and I wrote something kind of interesting. Patient presents with an assortment of problems. So I thought that was kind of funny because you did, right? Like when you came in, you had shoulder pain, you had memory loss, you had generalized fatigue, you had arm weakness, and a few other kind of like random ailments that nobody was really treating and nobody was explaining.
That's right, yeah. I developed a little bit of a stutter or issues with word recall as well. So the shoulder thing had been going on forever, and when I added everything else to it, I was finally motivated to go seek help.
And you were at the time, because I definitely wasn't the first person that you saw, right? So can you kind of talk us through what happened, you know, who you went to, and for those of the people that don't know, and we had never really talked about this earlier, but I wrote a book and I put different ailments and how I treat them in the book, and you are the brain fog chapter.
Brett, I think is
my
name. That's right.
Have you read the chapter?
I have. Oh man, I was going to bring the book.
I have one. I was gonna give one to you.
I did. I ordered it on Amazon once.
What'd you think?
It was good.
Yeah.
Nice. Yeah, very interesting.
Nice. So can you tell us your story, you know, from your perspective?
Yeah, and it's, you know, I think I lumped my issues into two main categories, where I had been suffering with shoulder issues since late high school, early college days, old sports injuries, and sometimes it would pop out of socket, and then for 20 years just sort of dealt with the pain. And it would limit my ability. I play hockey as often as possible, and at the time it was limiting my ability to play multiple times a week. It was normally 1 week and then recover 1 week, recover.
And that was getting more and more, right? Like the recovery time
was getting
the
longer.
amount that you were playing to the amount that you needed to recovery that ratio was getting worse and worse.
It was getting worse and worse, yeah. And I think it was a year into COVID, I got COVID, and very quickly started to experience other issues, right? So I had the fatigue, what people classify as brain fog. It was impacting my speech and really impacting my short-term memory. And someone had referred me to you, and I said, hey, if this guy can look at my shoulder and has some theories on my brain fog, I'm all in. And so that's when I came to see you, and I don't remember the dates, but 3 years ago maybe?
It was August 17th, 2022.
Okay, 2 years ago.
Yeah. All
right. Feels like longer ago.
It does, it really does. I was surprised at 2022.
It's the COVID time continuum.
Right. So kind of your thoughts on the first visit, if you can remember. So you came in, I examined you, we talked a little bit, and then I looked at your movement, I pressed on your spine, and then I said, I don't know if you remember, but I pressed on a certain area, and it was pretty painful for you.
Now that you say it, I do. I gotta be honest, my memory from that stretch of time is not very good, even on the home front, work-wise. So some of those early days, I don't have a ton of recall. But now that you say that, I do remember sort of the radiating pain coming off my upper right quadrant.
Yep.
And I remember that because I had it for, the next several months for sure in each visit. And I should add that before that, I had gone to see my primary care. I had done pictures of my shoulder. And then it was really when I got the brain fog, and people just didn't know what to do.
Yeah, so you saw your primary doctor for your shoulder. They did imaging for your shoulder, right? And this is kind of my problem with the healthcare system in general. And not that shouldn't be a step, but whenever you say this body part hurts, all they do is look at that body part. They don't look at you as a whole.
Yeah.
So you've been having shoulder problems for a while. You saw your doctor did imaging, didn't really have a lot of explanation from the imaging. Now you're starting to get cognitive changes to the point where you said you were having memory loss, and even to the point of not remembering being at a dentist appointment.
Yeah.
A few days before you called to reschedule your appointment or to schedule your appointment, and they're like, hey, you were just in.
I needed a crown put in.
Yeah.
And I couldn't remember, and I called the dentist. I said, I need to have this done. And apparently I had been there 3 days before. All the work was done.
Which is kind of insane, because I mean, people remember going to the dentist,
Yeah.
right? You remember getting a crown put in. A cleaning is one thing, but a procedure, that's something you remember,
Yeah.
right? So you not remembering that kind of shows how bad your memory or even like your attention was at the time.
Yeah, even eating. I struggled with, I would have lunch and I wasn't hungry, but because of my fatigue, I was trying to remind myself, like, stay healthy, eat. And my wife would often remind me that, no, you've already eaten.
And again, I read this recently, but you were struggling at work. You were saying you were struggling to wake up. In the morning, you said that a few times a week, 4 times a week, you'd feel basically crippled in the morning.
Yeah, mornings were tough. Work was tough, particularly, I have a story that my mom just told last weekend, so it's fresh, where, she came down to visit and my desk was covered with sticky notes, and that was sort of how I got from day to day. And I got very good at, in particular meetings, writing down key things so that the next day when the topic came up, I had some recall of what was being discussed.
So you were just compensating for it.
Yeah. And then my boss was great and covered a lot of presentations for me, because, the word recall would really trip me up. And when you're doing that in large presentations, it doesn't often resonate with the crowd.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
And you were telling me too, even just a conversation like this, you were struggling to kind of stay engaged. You were struggling to talk in the conversation.
Yeah, it was the word recall. I'd get hung up on trying to think of a particular word, and I couldn't.
So what did you do? Who did you see at first for these issues?
I saw my primary care. At that time, brain fog was very new. It was a concept out there, and really the suggestion was it was a vitamin sort of mix.
Okay.
I honestly don't remember what those vitamins were, but I had 6 or 7 different vitamins that I was taking.
But you tried them?
I tried them.
And any change?
No change.
And this is something I always tell people, like, if you're doing something and you're not seeing a pretty significant change within 4 to 5 weeks, kind of that should be about the cutoff. You're doing the wrong thing or to the wrong area, right? So the vitamins weren't working, then what'd you do?
I was at that time, I was having dinner with a friend, and he brought you up and said you were pretty convinced that through the spine you could have positive impacts on other parts of the body. And it was the first time, because people had recommended physical therapy to me for my shoulder. But I have 3 young kids, pretty demanding job, and time was just, when I did the cost-benefit analysis,
Sure.
I didn't have time to spend 2 hours once or twice a week, because your office wasn't entirely convenient to my house.
You were saying it was about a 35, 40-minute drive.
40-minute drive.
Yeah.
And I had to do it during the work week. So, I would take a meeting on the road, be at your place for an hour, take a meeting on the way back. But anyway, when these other issues compounded my need, and you were a potential solution, I said, you know what, why not? Let's go try it out.
Yeah, which I mean is really cool. Honestly, I'm so glad you did, because I've had these theories for a while, and I've seen some other patients with these like vague, nebulous conditions and symptoms that are getting kind of poorly classified in the medical world as it is right now, under these umbrella of these other conditions that are just kind of generalized labels, right? And we've been seeing a ton of success with them, but brain fog, and especially to your extent, was not one that we had worked on before.
Yeah.
And I remember too, so I have on your first visit, I asked you, what do you think the cause is for this? And you basically said, I don't know. I have here, you're like, maybe it's a combination of like anxiety, depression. You said you have 3 kids under 9. You're at 10 practices a week. You work a full-time job, and I'm kind of a guy in the same boat. 2 young kids, work a full-time job. Trying to stay active. Like that causes a lot of stress in and of itself. And then when your body isn't responding the way it should, now you're starting to think like, is it physical? Is it mental? You're
getting older.
Is it just age? Yeah. So,
Right.
and did anybody say like, maybe you could be anxious, maybe it's stress?
I think so. Probably. I'm trying to think of, certainly on the home front, I would say, with my wife and I, maybe we need to catch a breath, which is tough to do when you're
you're in the thick of it,
when
right?
you're in the thick of it. And honestly, part of my problem too was one of my real outlets was playing hockey, and then that was slowly being taken away from me, and so I'm playing less and less, and then I'm compounding issues.
Well, and I want, because the way you put it was perfect. You weren't doing as much, but you needed even more and more time for recovery.
Right.
And I think that's something that can resonate with a lot of people. We didn't talk about this at all when you were in, because you don't want to hear the complaint of the person trying to treat you, right? But I was actually going through something pretty similar. I've had shoulder problems for almost my entire life. I was a baseball pitcher, and it seemingly progressed to the point where I was having trouble putting my hands together. I was washing my face one day, and I went to put my hands together, and I was like, wow, I can't do that. And I was struggling to wake up in the morning. My energy was going down. I would still be able to do everything that I wanted to do, right? Like for me, it was racquetball. For you, it was hockey. But the amount of recovery I needed after it just kept getting longer and longer and longer. And again, maybe it's age, maybe it's diet, what else could it be? Maybe I'm just stressed and anxious, maybe I'm depressed.
Yeah, and for me, COVID definitely played a factor in it.
And that was the other thing, could it just be long COVID?
Right. And at that point, no one's really offering an opinion on how long you'll have it. Is there a solution for it? I think a lot of that is still unknown.
Sure,
So that definitely created the spike for me. No doubt there was added, stresses at work, et cetera. But no doubt COVID triggered a spike. I attribute the brain fog to the extent that it was impacting my speech to COVID.
Sure.
And so that was sort of the unknown at the time and what I was trying to solve for.
Well, and like the way you put it, triggered, right? Like you had already had shoulder issues, and those shoulder issues were stemming from your spine that we showed, right?
100%.
So it was kind of like that almost straw that broke the camel's back, so to speak. You just had one more thing that compounded your body, your health, and it was like, all right, your spine was like, I'm out.
Yeah, yep.
So we started treatment. And I have in here, I had to refamiliarize myself with these, but we went through, what were you thinking as the treatment was going on? How long into you were like, this is something, or, after the first visit, are you like, this isn't going to help, this?
It's funny you say that. I was still really unsure through, I would say, the first 4 to 6 weeks.
Okay.
And if I remember correctly, my timeline's probably not exact, but eventually, first thing was my shoulder. And it just started to not hurt when I would play hockey. And I would skate on a Monday, and I was ready to skate again on a Thursday. And it was like, okay, this is great. I think my fatigue was also starting to get better at that time. My speech and memory took a bit longer. And I can tell you when the story, and I actually tell this story a lot, because what's crazy is I was actually driving to your shop in, Hatfield? Mm-hmm. And something that happened at work, And I think a lot of people do this. I'm not sure I'm going to make myself sound crazy, but I started to have like a lot of internal dialogue. You know, well, if I do this, then my boss is going to think this, and if I don't do this, and I almost drove off the road because I hadn't done that in seven, 8 months at that point, and I didn't realize I hadn't been doing it for 7 or 8 months, but that was it's part of my everyday life. On the way here, I probably had 27 conversations in my head.
Yeah, game planning, right?
And it was the first time I'm like, oh my goodness, like my cognitive ability has really been that hampered. I didn't really know until it started to come back. And I went in to your office and, you know, big smile on my face. Yeah, I forget who was treating me at the time, but I was like pretty wild. On the way here, I got my ability to sort of have internal conversations and weigh dilemmas and that sort of thing that I hadn't done in a long time.
Well, like what you said, and this is the case for a lot of people, you don't really realize it until it has changed one way or the other. Because it's such a slow process getting there that it almost becomes your new norm, right? You think this is the way I've always been, you know, because it took probably, again, it was your shoulder from your spine over those years, and then your spine just kept getting worse and worse. So it took years for you to get this. Obviously, you know, COVID was that kind of last inflection point. But it took years for you to get here, and this is just who you are now, you know? And until that drastically changes, until you're able to compare it, you don't realize the difference.
Yeah.
And one cool thing, so you're about right, you know, again, I looked through the notes, so I cheated. But the first thing was about 2 weeks, you had decreased arm pain, you were able to travel with less fatigue, you were saying. And then right around 4 weeks, you said about a 60% improvement. Now you're waking up without difficulty at 6:30. You said you were always an early riser, and that was something you were struggling with. The mental clarity during work was getting better, and then your shoulder was still getting better. And then, so this says September 15th, so that's about 2 months after. This is where you're starting to dwell on things. You were starting to think on things and like ruminate on them a little bit more.
There you go.
And you didn't realize that you had not done that. And that you said that was your normal. You weren't going to sleep at night normally because you were thinking about things. And you hadn't done that in a while, and now all of a sudden you're doing it again. Yeah,
it's funny you brought that up because I had forgotten I was sleeping so well at that time because my
didn't have a thought. Yeah.
My brain wasn't racing at night with all the crap I either didn't do that day or I had to do the next day.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
I missed that.
That's the ignorance is bliss, right?
Yeah, ignorance is bliss. Exactly right.
Well, and one cool thing here too is like looking through your notes, you got sick again. It wasn't COVID, but you got sick again about right around after this visit, and you stopped doing your exercises. And when you stopped doing your exercises, you started to notice the symptoms return.
Yep.
And I think that's kind of cool in the sense that it shows that correlation, right? Because a lot of times, you know, people are going to be watching this and they say, well, maybe he was just recovering from COVID and it was just circumstantial, right?
Yeah.
You know, that it happened to be in that timeline, or maybe his shoulder got better because of something else he was doing or whatever, right? But you got better after doing the exercises and you got worse when you stopped doing them, and then you started doing them again and you immediately jumped back on track and you were better. So it like really shows that positive correlation between doing it and not doing it.
That's right. Yeah, I'd forgotten that, but
I didn't remember a lot of this stuff. I had to look back. Again, you know, 2 years, like what you said, this is 2 COVID years. So,
2 COVID years.
Yeah,
it's
those
a long
are
time
those are
ago.
long years,
Yeah.
right? And so how about now, you know, jumping forward to today, what are your symptoms still there? Are you doing your exercises?
I'd say I'm back to my old normal, which is so much better than at that time, what I was sort of hoping wasn't my new normal. My shoulder has been remarkably stable for the last 2 years, which is really amazing.
And did we do anything to your shoulder when we were working on it? Did I stretch your shoulder? Did we do a lot of rotator cuff exercises?
No.
But you've had shoulder pain for 20 years, right?
20 years.
And you've been to physical therapy?
Yeah, a long time ago.
Okay. And they did the band shoulder exercises,
yep.
right? And they did some stretching and...
That's right.
Did it help?
No. I would say and now when I have a little bit of shoulder pain, I will do the very light exercises that I did with you a couple years ago. And after a couple weeks, I'm completely pain-free.
Nice. And that's what we want.
Yeah, my shoulder it's like a non-factor in my life.
That's awesome.
Which is really cool.
Still playing hockey?
I'm playing a lot right now.
Nice.
3 days a week.
Boys still playing?
Boys are still playing.
Nice.
Yeah, I played last night. Got home very late.
And soreness, fatigue afterwards?
No. I was sick this fall, and was fairly, I don't know what the right word is, complacent. I didn't do much. Noticed the fatigue coming back, but it was very short-lived. So I'm hoping my ability to sort of rebound from these things is also stronger. Let's see.
What would be kind of your message? You went through this, and again, nobody's really offering an explanation. What would be your message to people that are in a similar boat?
My message is I had a few issues, right? I had a laundry list of stuff that wasn't right.
Was it an assortment of problems?
An assortment of problems, and a few months of sort of stretches working on my spine solved all of those problems. It's pretty remarkable.
Did any doctor you go to say, hey, this could be a spine problem, your shoulder, your brain fog, your fatigue?
No.
Have you met anybody since that said, oh yeah, I would have thought that?
No.
And how about, you said, you're telling these stories. What do people say when you tell them?
I've probably done a poor job marketing for you because I lump it under, physical therapy. I'm
not a big fan of the term. I want something new, but I don't know what to call it.
Right. So, this conversation sort of reinvigorated me that I've probably been selling my experience to your detriment almost, right? And I'll do a better job moving forward.
Well, I think this counts, right?
Yeah.
This is helpful. Getting this information. Well, and honestly, getting this information, my goal is to create medical change. I really want to, I see a better medical system with this approach at more the forefront than the back end.
Right.
In order to not only diagnose, but also treat a lot of conditions out there that are mismanaged and mistreated in the medical system. And you've mentioned a few that people struggle with. Just shoulder pain, right? Just shoulder pain that it's primarily caused from your spine. You had shoulder instability. Everybody would say that was a stability problem from the rotator cuff not being active, from your labrum being torn, from the humerus not sitting right in the glenoid fossa. Like they'd have all these explanations of sick scapular syndrome and serratus anterior weakness and all this other stuff, scapular dyskinesia. They'll throw all these terms on it, but it's not. It's a nerve signal from the spine not getting to your shoulder.
Yeah, this might not sound right, but I went to a few doctors looking for surgery. I wanted someone to cut me open.
You want somebody to fix it.
Stitch something and have my pain go away.
Right.
And it just wasn't an option. So.
And good that you didn't. I actually had shoulder surgery. But this is back when I was in college, and I regret it every day. My shoulder came out worse. I now know I didn't need it. I know for beyond a shadow of a doubt that it was a neck problem because I had pain, numbness, and tingling running down my arm when I was just sitting in class. And I thought that if my shoulder was that bad to cause that when I wasn't doing anything, that I absolutely needed surgery. So I regret doing it. But so you had the shoulder problem, you had brain fog, I mean, and fatigue issues, and I can't tell you how many people in the world are suffering with that right now. And I can almost guarantee you that nobody is telling them, hey, this might be your spine, let's get your spine checked out. They're going the anxiety route, they're going the depression route, they're going long COVID route, they're going for fibromyalgia route, they're throwing all these other terms and conditions and labels on it that, and that still may be. But I know that there are people out there that, just like you, were suffering because they had an issue with their spine, and if they get it properly treated, they can be cured.
Yeah.